And thank you very much, Ceann Comhairle, for giving us the opportunity to discuss this very important issue. The National Orthopaedic Hospital, Cappagh, treats patients from all over our country for a broad range of orthopaedic conditions. The hospital has worked very hard over the years to improve access to treatment and increase patient numbers. In Cavan, Monaghan and in our neighbouring counties, we have many patients of all ages on long orthopaedic waiting lists. These waiting lists, and in so many instances, people in pain and immobile, are not acceptable. I know from patients and from people who have supported Cappagh over the years that they have the space to facilitate the provision of much-needed additional capacity, both theatre and bed capacity. I understand that there are detailed and costed proposals with the Department and with the HSE, which, if implemented, could be transformative for orthopaedic care nationally. As well as new accommodation, some existing accommodation needs to be replaced, and there are also the additional requirements arising from COVID. The changing demographics in our country has also increased pressure on orthopaedic provision. I have a particular interest in Cappagh, as years ago I had a back operation there, and I am forever grateful for the treatment and care I received at that time. And I know that many other patients are very conscious of the excellence of care that they get in Cappagh. That has been the constant message that I have received over the years from people who have attended Cappagh Hospital. Ceann Comhairle, it is heartbreaking to see children and teenagers in pain and immobile due to not getting appropriate treatment and surgical intervention. In this day and age, this is just not acceptable. I know of young people who are in dire need of orthopaedic surgery, but they are on extremely long waiting lists, and in the meantime, sadly, their condition continues to deteriorate. The state has an obligation to ensure that no child is denied unduly the treatment and surgery they need. Thank you, Ceann Comhairle.
Thank you, Cathaoirleach, and I want to thank the two deputies for putting in this topical this evening. And I'm taking the responses on behalf of Minister Donnelly. Okay. I would like to thank the deputies for raising this issue and giving me the opportunity to provide an update to the House in relation to waiting lists in the National Orthopaedic Hospital, Cappagh. In relation to paediatric orthopaedic waiting times in recent years, there has been an increased investment in paediatric orthopaedics and scoliosis services, which has improved access to surgery and outpatient appointments. In 2018, Children's Health Ireland was provided with an additional €9 million in funding to address paediatric orthopaedic waiting lists, including the provision of scoliosis services. The funding supported the recruitment of approximately 60 whole-time equivalents in 2018 and 2019 to enable the expansion of the paediatric orthopaedic services, including scoliosis services. The posts relate to multidisciplinary teams at diagnosis, pre-assessment, during surgery in theatre and post-operative. In general, waiting times for scheduled appointments and procedures have been impacted in the last year as a direct result of COVID-19 pandemic. Elective hospital care was further curtailed for the first quarter of 2021, in line with the rapid increase in COVID-19 hospital admissions, with only critical time-dependent elective procedures undertaking. This has also affected activity in the Children's Health Ireland. For orthopaedics, I am advised that Children's Health Ireland is expanding its activity in Cappagh Hospital and is also running additional orthopaedic clinics in City West, using a new active clinical triage model, which is reducing the number of children waiting the longest for appointments. Children's Health Ireland proactively continue to work with the HSE and my department to reduce waiting times for patients attending the scoliosis services. I am advised that funding has been provided for additional paediatric orthopaedic clinics at Cappagh Orthopaedic Hospital, and an additional outpatient clinic commenced on the 17th of February. I am further advised that additional theatre capacity for day case surgeries at Cappagh commenced on the 26th of April, and this should result in a significant positive impact in reducing long waiting times for general orthopaedics, in addition to scoliosis patients. The deputies might also wish to note that in January this year, the HSE added a €1.65 million project for development of an outpatient paediatric clinic to the capital programme. which will be considered for progression subject to the availability of funding next year. And it is expected that will further increase Cappagh's capacity for paediatric orthopaedic services. I thank you.
Mr. Rabbitte, Deputy Smith.
Thank you, Cancor, and I thank the Minister for a reply. Minister, while I welcome the announcement, the facts you lay out there, sadly, the additional funding that has been allocated will not be transformative to reduce dramatically the waiting list. That's the sad reality. As Deputy Cahill said, the ethos in Cappagh Hospital, and having been a former patient myself, is can do, will do. They want to carry out more procedures. They want to treat more patients, but they need additional theatre capacity and additional bed capacity. They have to replace some of their outdated existing accommodation. And of course, there's the extra requirement because of COVID, and they want to meet with all the necessary accommodation requirements. Minister, I know some of the children who are on the waiting list, and I'm very conscious of the suffering of those children and the absolute distress and worry of parents due to such long waiting lists in accessing necessary and much-needed treatment. I spoke to a mother of a young child, a 14-year-old, who was waiting for treatment last Sunday morning. I discussed the case again with the young boy's mother, and she said he had gone back to school, not mobile. His friends are participating in their sports. He's not, because he can't get the treatment and the surgery he needs. There are hundreds and hundreds of other children, sadly, in the same predicament. And we have top-class clinicians and support staff in Cappagh who want to treat those children, who want to carry out the procedures and give those children back the quality of life that they need and the quality of life that we want to see every child have in this country. Minister, a detailed costed proposal, as Deputy Cahill said, is with the department, which can be transformative if that additional capacity is provided. Cappagh not crying out for additional staff. They're crying out for additional accommodation so that they can do more work to ease the pain and suffering of children and adults throughout this country. It's the National Orthopaedic Centre. It treats patients from every county in our state. We need to give it the resources and the capacity that they can reduce dramatically the waiting list. None of us want to be meeting people in our clinics or talking to them on the phone, people of all age groups who are suffering, who are immobile. It's not just good enough. Minister, the Taoiseach has quite rightly spoken that maybe the pandemic, and we know the hardship and suffering it has brought to this country and to so many families, maybe it will be transformative in regard to the way we deliver health care. Let us go. Let us be transformative. Let us put in place the investment in the facilities to ensure that their better quality of life is provided for those people, and particularly those children waiting for treatment. Thank you, Ceann Comhairle, and I thank the Minister. Very good
cases, actually, to be honest with you, Ceann Comhairle. And only yesterday I did meet with Minister Donnelly, where we discuss children and we discuss waiting lists. And I think I sit on a weekly basis beside Deputy Smith, because that's where my normal seat in the House is, Ceann Comhairle. And I would discuss with Deputy Smith on a weekly basis about children's rheumatoid access to services. So I'm acutely aware of the conversations we would have had. And every evening I watch my Twitter machine and I see very clearly about children who can't access orthopaedic services, and I talk particularly about Down syndrome when I have this conversation. But I will take on board the compelling pleas that both the TDs have done here today. I hear exactly what you are saying, and yes, we do want to leave a legacy that we can do it differently in health, and that we can make priorities and we can have an access to care. And that's where I was talking with Minister Donnelly yesterday about is it's about the Access to Cash Fund for access to care, to actually how is it going to be used to make a difference to young people's lives? How are we going to prioritise? How are we going to get our waiting list cleared? And how are we going to ensure that the parents of the country that are going into everybody's constituency clinic at the moment that are waiting on far too long of time, how can they access it? I would like to attend and go out and see Cappagh like Deputy Cahill has done this week. I think the whole country speaks very, very highly of the services that they deliver. And it would be wonderful to see as to how they could put an action plan in place to deliver on the assessments, while at the same time, if the investment could be done for a delivery there. So I would like to attend it, and perhaps Deputy Cahill could set that up for me. Thank you, Ceann Comhairle.